Okay, so we have here the different tests for the evaluation of your problem related to your coagulation factors. Okay, so the tests here are actually clot-based. So it tries to measure here the time when your sample enabled to form here clot formation. So the first one, we have here your clotting time. So clotting time is considered to be the screening test for the problem related to your coagulation factors. So problems related to your coagulation factor, you're not able to produce your clot formation because you have a deficiency in your coagulation factors would tend to increase your clotting time. It would have your prolonged na clotting time result. Okay, so we have here different method for the clotting times. The first one, we have here your capillary blood or with the use of your skin puncture. So you can have here your drop on a slide method. So procedure for that one, so all you need to do is just label here your test tube. You put the number 1, 2, 3. So all you need to do here is just perform the skin puncture. Then after that one, try to drop it. Okay, unahin mo dito sa number 3, 10 to 1. Then, every 30 seconds interval, you try to check for the fibrin clot formation. So, all you need to do here is just flick this one with your lancet. Okay, then wait until this one are able to form here para siyang fibrin, the fibrin clot. Okay, the time of your clotting time here would be the time when you're able to form here your fibrin clot in your number 3. Another one, we have your capillary tube method. Procedure for that is just collect your blood by skin puncture and then put that one in your capillary tube. And every 30 seconds, you need to break your capillary tube. We break mo siya until you're able to find your fibrin clot. Until you form here the fibrin clot. That become your clotting time. The problem with your capillary tube method, your Dale and Lade's law, since we are puncturing, we are breaking your capillary tube, so medyo risky yan. So baka masugatan tayo. Okay, but then again, just like your drop in the slide method, it will just measure the time for the formation of your fibrin clot. Okay, so normal values for that, we have here 2 to 4 minutes. Another one, you could also perform here the whole blood with your Lee and the White method. Procedure for the Lee and the White method, you'll just be collecting here 3 ml, or you could have your 4 ml the blood. Okay, and then prepare 3 test tube, label this one as 1, 2, 3. The first 1 ml, you put it one in tube number 3, followed by tube number 1, and tube, followed by tube number 2, then followed here by tube number 1. So for that, all you need to do here is just observe for the clot formation. So how are you going to observe here for the clot formation? So just need to tilt your tube every every time. Wala naman, din naman siya 30-second interval, just like your clotting time here with your drop in the slide method. So all you need to do is tilt, okay, until na hindi na gumagalaw ang blood natin in your test tube. Okay, try to take note your clotting time when tube number 3, we're going to form here the clot na hindi na siya gumagalaw. Tube number 3 palagi ang ating basis for the clot formation. Again, going back here with the drop in a slide method, just like when we are doing your bleeding time, so at our report for the result here, dapat 30 seconds interval ang reporting natin. So wala tayong result na may butal. So like ang report natin dapat is 30 second, 1 minute, 1 minute, 30 second, or 2 minutes, or so on. Basta there should be 30 seconds interval. So for this one naman, hindi naman siya nakaspecify na 30 seconds interval ang reporting natin. It would be dependent on the exact time of your clot formation in tube number 3. Okay, normal values here for the Lee and the White, we have 7 to 15 minutes. Again, problem related to your coagulation factors will have a prolonged na clotting time. Okay, now we go to your coagulation studies. First, we have your PT or your prothrombin time. So the prothrombin time is a screening test primarily for problem related to your extrinsic pathway and your common pathway. So that will try to detect problem related to your factor 7, factor 3, and we have also the common pathway 10, 5, 2, 1. So since what we are detecting basically in the plasma of the patient is the factor 7. So, ang ating reagent is your factor 3, which is your tissue factor or your tissue thromboplastin. Our blood is being collected with your light blue top. This 1:9 na anticoagulant blood ratio. Okay, that's with your blue top or your citrate. Okay, so what we are using here as our sample would be your PPP or your platelet poor plasma. We have discussed already how to prepare your platelet poor plasma. It's just a matter of centrifugation lang. And we're highly dependent on the time of the centrifugation as what we have discussed as our introduction with your hemostasis. Okay, so basically that one, platelet poor plasma contains less than 100,000 platelets. Okay, so this will be the sample for that. Okay, then our agent is your tissue thromboplastin plus your calcium chloride. Okay, that one is primarily your tissue thromboplastin. It's a combination of your tissue factor plus your phospholipid in a 0.025 molar calcium chloride. So since factor 7 would be the start with your extrinsic pathway activation, so this is factor 3 combining with factor 7, which further try to activate your common pathway, proceeding with your factor 10, 5, 2, 1, and of course try to time for the clot formation. Okay, procedure for that one, so first just need to warm your agent at 37, then you add your platelet poor plasma in your spectrophotometer or coagulometer. Then after that one, you add your calcium chloride. Pag manual procedure ito, you start the timer ng clot formation natin as soon as you add your calcium chloride. Pag nag-add kang calcium chloride, remember calcium chloride is needed in your clotting process. So as soon as you add calcium chloride, you try to start the timer and stop the timer when your clot formation has been formed. Pero kasi may mga automated instrument tayo na hindi tayo nagmamanual naman. So the instrument will be the one na mag-monitor ng clot formation. So, only that is one is a clot-based na test. Then, you need to run your control and your result here should eventually, or the result of the control should be within a control level in order for you then to consider your sample here as valid or not. So, you can duplicate your test procedure and when you are doing that one, dapat ang difference ng dalawa na result here would be 10% lang ang kanilang difference. Should not be more than that. Pag more than that, na sobrang layo ng result nila, then you need to repeat your procedure.